Hi everyone, I'm Chang. I'm a neonatologist, and this is I'm going to talk to you today about a development of integrated boot camp that was developed during my time in New York. So as you know, clear communication with empathy is an essential skill in the practice of medicine. And in our field, neonatology, we're often called to have these serious conversations with parents and their families, while at the same time providing intensive medical care to their babies. So in fellowship training, or in fellowship programs, communication training is predominantly a half-day classroom session, didactics and simulated conversations. And while this is really helpful, it doesn't really go far enough in preparing fellows for the complexity and the cognitive load that comes with the real world. And so the objective with designing this boot camp was to create an integrated clinical and communication simulation-based boot camp that would offer fellows an opportunity to practice and toggle between these fast-paced, high-risk medical scenarios and at the same time have these more paced, more measured, slow conversations with families about what's going on. Because in real life, these are often happening simultaneously or one after another. And so the ability to go back and forth, fast and slow, we felt was really important in training, and something we wanted to give our fellows a flavor for before they actually became attendings and had to do this in real life. We also took this as an opportunity to survey fellows on what kind of real life experiences they were being offered in terms of having these serious conversations with families, and ways that they perceived communication training could be improved for them. So learning objectives and scenarios for this boot camp was developed based on a needs assessment of regional faculty and program directors that participated in this boot camp. This was a one-day, full-day boot camp for second and third year fellows, open to all fellowship programs in the New York metropolitan area. During this boot camp, fellows were refreshed or provided an introduction to communication concepts, during utilizing didactics as well as small group discussion. And then in teams, they participated in paired clinical communication sims to practice these skills. So for example, one scenario would be medical management of hyperkalemia, leading to ventricular tachycardia, leading to an arrest. Immediately after that, they had to then talk to a family member and explain that the arrest or this whole situation happened because of a medication overdose error. So kind of giving them an opportunity to kind of tackle two very different things, but very related in our field. Another scenario was fellows were tasked with delivery room resuscitation of a newborn. And despite their best efforts, we made them unsuccessful in the endeavor. And so they then, after that resuscitation, had to go tell the parent that their baby had died. So it was really intense, really challenging, but I think something that we all felt was really lacking and important in our trainees' education. So let's see, in total, 88 fellows from 8 fellowship programs attended over this 2-year period. The pre-surveys, we asked about kind of their general experiences and what things they did in real life. 58% reported that they always or often were expected to deliver serious news to families. Of these, 68% reported being accompanied by a supervising attending physician. However, only 32% reported that they were actually always or often given feedback on how they communicated. So there are definitely some areas of opportunity for us here, both in including our fellows in real world conversations, as well as providing them with feedback. We assessed pre-post bootcamp participation, fellow confidence and preparedness for different domains of serious news conversations and goals of care conversations. Sorry, it's so small, but it's stratified by training year, so the second year fellows and the third year fellows, and pre to post on a Likert scale of 1 to 5, 1 being least and 5 being the most prepared or confident. We saw an improvement in all of the various domains in serious conversations after the boot camp. Post boot camp, 89% reported that they also felt like this integrated approach where we did medical scenarios with communication scenarios was highly effective and extremely helpful. And in a 6-month follow-up survey, 73% of the fellows reported that they daily or almost daily use the concepts that they learned during this boot camp in their daily practice. Nearly 100% of faculty reported that between the didactics and the simulations, this program filled a gap in their existing curriculum. So in conclusion, we found that it was indeed possible to integrate both clinical and communication skills training, and that it does lead to at least reported fellow confidence and preparedness for delivering serious news, and that at least in some areas of the country, regional boot camps are a feasible and effective way to provide this integrated training and supplement NICU fellowship curricula.